Hello, everyone. Y'all know we're back. Yes,
Hey.
live here on YouTube once again. And we have some good stuff for you today. So, you guys met Miss Karen before, and she was getting our health together. Okay, all of us.
Mm-hmm.
And so she's back because we had more questions now that the shock has worn off about you guys and your partaying. I will never forget that. Where did you
That's
have your party
right.
at?
Where you having
Yes.
a party at?
Where the party at? That's what she
Yeah.
said.
Stuff in the eye and stuff in the throat. I'm just going to leave it there because we don't know who's listening in. But we needed some time to process and get the shock out. As a result, we're not doing word of the day. We're jumping in because we feel that
Okay.
this is a state of emergency.
Okay.
we
Yeah.
just we need to know a lot more,
Yeah.
and we need to know if anything has been updated since the last time that we spoke. And so Miss Sounds is here with us. Miss Sounds, say hey, hi ho to your people.
Hey y'all, how y'all doing? Miss House here, and I'm happy. I'm excited to be here with you, Karen, and with you, Azali. I love being
Okay.
with y'all.
Me
She's
too.
excited. I'm nervous because I'm hoping I've grown since the last shock.
we had,
I
we
mean,
had about 4 months.
Right, exactly.
oh my goodness. But
Thank you for
listen,
having me back.
we had to have you back, Miss Karen. I mean, there was no voting that was needed.
No,
Right
America
now,
said,
there
"Bring
is
you back."
votes needed out there. Go vote. But this one is needed because I realized I was outdated with some of the healthcare decisions and realities as I once knew them. And so, man, when you know better, you should do better. And your conversation with us just left a lasting impression on me and questions I want to ask my children at every appropriate stage of their lives.
Yeah,
Exactly. You should.
I got my
absolutely.
next year questions and my couple of months questions and 2 years down the line questions because I don't want to be blindsided. So we had to have you back. So thank you for agreeing to come back. I want you just to give the people a refresher as to what you do and where you do it and why.
Okay, so I work at Sun River Health, and happily, Sun River Health is a organization that was started by four beautiful Black ladies who didn't feel that they had any help or have any kind of hospitals or health clinics nearby, and so they started a small, tiny storefront in Peekskill, New York. Now that it has grown now to over 50 sites throughout all of Long Island, the five boroughs of New York City, as well as going all the way up to the Catskills. So like it says, we have 50 sites and growing. As we speak, they're even like rebuilding and fixing up and expanding a lot of our buildings as well, because it's just a well-needed program, because it not only helps anybody, which means if you're underinsured or uninsured, we help you too as well. We are people that wants to help our community. And so with what I do is I'm a sexual health prevention coordinator. And what does that stand for? Basically, I try to help people remain HIV negative and hopefully as well STD free as well through education and through the programs and the medications that is out there. And we want to be able to let people know about these things so that you can remain healthy as well as taking care of your children. Because as we know, sex is not just an adult thing. And so we're going to be talking not only about, that, but we want to get into with the teenagers as well and how you can help your teenager.
Yeah, I want us to start at the teenage level because I feel as if we gave a lot to the adults, right, Miss Sound? So
Yeah.
teenage level is where we want to start most of our conversation, and then we'll see where it runs. I'll say for me, hot off the presses as to what I'm still digesting. I don't know if I'll ever digest it, but this thing of chemsex, I just didn't think there was such a thing.
Right.
Understand everybody out there gonna have stuff to say. I'm mature enough to say I just didn't think of it. I don't know what you want me to say. I'm still shocked by that one. I need you to tell us again what that is and really how harmful that can be. Because I understand we're talking about sex education and having sex when you still don't understand much of life or yourself is dangerous. But when you add the component of drug to it, I'm just saying, baby, fire will burn you.
Right.
Talk to us again about chemsex, what it is, and just how detrimental it can be to those involved.
Okay, so chemsex is also known as party and play. And what a lot of times within that category in itself, a lot of times they talk about it more as men having sex with men using that terminology, chemsex and party and play. But, to shorten the version up, it goes for anybody, because what the main component of chemsex is them having using drugs, especially like say crystal meth as their way of having sex easier. So when you having certain chemicals, certain drugs inside of your system, your drug of choice inside of your system, it kind of loosens your body up so that you are able to do a whole lot more that you don't realize that you're doing. So something like that with chemsex and then using that, you will see a lot of people being able to have at that time easier anal sex,
Mm-hmm.
easier vaginal sex, easier oral sex because you're in your own world and your own land. So, but you take it into other levels too. How many people out there, I'm listening to the people that I talk to and know what they say to me. And I know a lot of people say they've had sex while they were drunk or they had sex while they were high. So don't look at it
Yes.
just as just a drug. Look at it as your alcohol of choice. Look at it as, maybe just wanted to, sadly enough, sometimes it would, that too is just trying to please your partner and making it
Yeah.
so, they'll get you drugged up so that they can also pimp you
Yeah.
out as well.
Yes. Yeah. That
And
was one of my concern. I'm so glad you connected to that because we've had guests on here to talk about uh teen abuse, abusive
mhm.
relationships, obviously suicide, depression, anxiety. And so when you mentioned that chemsex one, I could see that just naturally outside of life just beating me over the head, then I introduce something that removes all my boundaries, all my inhibitions, all my decision making. Now I'm out here. Oh my gosh, I am out here. And so that's why I wanted you to bring
Yeah.
that back as one of the first things to touch because as human beings, we're playing with fire and think we're not going to get burned. And then you want the fireman to come rescue you. Excuse
Right,
me.
right.
You set the fire. Go ahead, Miss Sounds. Get the people. I'm going to stay calm. I'm going to stay
I
calm.
want to I want to stay in this space for a little bit because one of the things that I'm discovering in my life is just the underlying reasons and intentions behind choices, right? And so in this particular scenario, I just wanted to kind of discuss what may be some of the intentions in willfully wanting to disconnect from your body and all the signals saying this is a boundary and I'm going to push past it and do this particular thing. What might be some reasons people want to escape their body for the moment of doing this,
Mm,
or you know, give into the pressure of someone else by escaping through chemsex?
Okay,
yeah.
so one of the things I can say is like when they're doing it, say for the example of saying crystal meth, people go to literally crystal meth parties. It's literally, I have a group that I deal with constantly, and every weekend they do a crystal meth party. And so most of the
Mm.
times on Mondays are my days where I know I get to meet some of the people that came to the party that didn't know some of the things that's going on there and learned real quickly. So sometimes it just going out there, just wanted to have fun, trying to do something adventurous, trying to do something fun. And then they kind of, when they get actually in the midst of it, they didn't realize how much they were going to put their whole body out there.
Mm.
And some of them
Mm.
definitely have been regretful and have come to me tearful,
Mm.
saying that they didn't expect or know, because sometimes they wake up the next day not even knowing what even happened to them,
Mm. Okay.
you
Yeah.
know? And so, they don't know, should they be calling it rape or should they be calling it, me being stupid? They don't know how they want to call it.
Mm.
Yeah.
So
Mm.
it also depends on that situation, where sometimes do we have to, say, if that's the case, do we have to call in? Happily, the organization that you're talking about, I deal directly with them. And so I may have to call them and refer the patient over to them. And they're a wonderful organization that maybe even putting a link to that video again so people can see that video again on the different things that can occur. So I won't get so much into all of that there, but we do, it says, linking our patients to organizations like that, because again, they don't know if they really was sexually assaulted, or again, it was, them saying yes and not realizing what they were consenting to. So
Yeah.
it's
Mm.
my fault. I did this to myself. I
Mm.
blame myself. So I get those kind of conversations a lot. So it's
So
just trying to be putting themselves out there to have fun, but not realize how far they're going.
so
Yeah.
so this that's a really great point, because what I hear you saying is that not all of the choices are just willful irresponsibility. Some of it is just naivete, like they're just new to the scene. They are new to, they want to explore the dimensions of fun,
Mm-hmm.
and just took a risk that they didn't know was a risk until the after effects came.
Because like you see a lot of times you hear about BDSM, was bondage and sadomasochism and dominance and all of that, where people get tied up and get whipped. There's a lot of, they call it fetishes. There's a lot of fetishes that people do to have fun, to make it a little bit more exciting. I know a lot of times they even say in marriages, sometimes some
Yeah.
marriages try to take it up a notch, try to make it more exciting, so I won't be bored after, say, 20 years being married to the same man. How do I make it a little bit more exciting? And
Mm.
sometimes I have plenty of people who are in marriages that said that they brought a third person inside the bed just to make it a little bit more exciting.
Mm.
Then becomes a little bit more hurtful, because again, the attention falls more on the third person, and one or the other of the couple always feel left out.
Yeah.
And
Mm.
then they're feeling like, wow, you're doing all of these things to them. So now I got to take it to another level so that you will like me back again and want to do all of those things that you did with that third person with me.
Mm.
So it's like sometimes a tit for
Wow.
tat that sometimes also goes on in some of those things, or they don't know, again, I had a couple that just came to me and was basically somewhat in that situation, and that third person had a lot of STDs. And so, some people like the chemsex party people that I kind of deal with, they kind of get themselves checked out a lot, so which is kind of a good thing there. But then when you have another set, which is my other set, they don't check that third person. Like, what do you have? What, let's get a piece of paper. Let's get HIV tested. Let's get STD tested if you're going to come inside my bed with me. I'm not here to judge anybody or try to
Yeah.
make anybody feel that they can't do whatever, because like I said, they're going to do it whether I'm going to judge them or not judge them. But
Yeah.
you have to think logically when you do some of those things to keep yourself safe. Forget even your partner, forget about the third person. Let's take care of me, myself, and I first. How am I going to take care of me? Because I'm more important than everybody else if you're going
Yeah.
to
Yeah.
be doing something like that.
Yeah, and that's
Yeah.
also why we have this disparity in identities, and it is getting younger and younger, because those of us who are mature are having this fun, as we label it, and these fetishes and exploration and investigation and all the wonderful words we want to throw at it, when you have no boundaries to make sure you're going to be okay. part of me being
Yeah.
okay is having a boundary,
Right.
right? Part of me getting my health check is a boundary in my life to say, listen, anything that's going to come to get me is going to have to wrestle me to the floor because I'm not going out like that. That's a boundary, right? And when you throw caution away from all boundaries and say, I'm grown, double grown out here, do whatever I have to do, then guess what? You get what you get. Now, you don't have to always keep what you get, but in the topic of today, obviously those boundaries, you get what you get. And if you're not treating what you get to keep it forever. Is that the way you want to go out?
Right.
Like, is that the way you want to go out?
Mm.
So I agree with you that we can't, we're not here to judge, but we are here to have an open conversation about reality and to say we love our people enough, whoever classify themselves as our people, to say, take another look, reevaluate that decision, reevaluate the definition and the terminology you assign to the word fun or grown or mature. Because if you're out here building legacy, you got to have boundaries. I'm serious.
Yeah.
What you want? You want to build something big, something great. You have to have boundaries. You have to have things that are absolute no matter who's bringing it to you, why they're bringing it to you, and how often.
And
right?
whether you're a teenager or whether you're an adult, it still all kind of falls in the same place that, we all want to feel loved, period.
Yes.
Everybody wants to be able to feel loved. And how we express our love is everybody does it a little bit differently. And, talking about when we say teenagers, especially, dealing with young girls, they're going to hear from a guy, oh, I love you. Oh, I want to be with you. Oh, now can you do this for me? Can you do that for me? If you don't do this for me, then you don't really love me. Oh, everybody's doing this. No, not everybody doing it. Not everybody doing it. They're just, sometimes it's words that comes out to make that person feel loved and then do the act that they wasn't really intending on doing it. And so really thinking about our teenagers, that's called consent, and the consent starts with yourself, meaning sitting in my bedroom by myself, thinking about how far do I really want to go? And if you put a label on yourself and say, this is all that I really want to do, even if, Bobby says, I want you to do this with me, you need to be able to express to that individual that that's too far for me.
Yes.
That's not
Yes.
how far I want to be able to go. And sometimes it's difficult because then I'm not going to be loved by that individual anymore. And that person meant the world to me. And that goes a lot also, that goes in marriages.
Yes.
I'm bored now being 20 years in this marriage. I need to up the level a little bit. I need to, maybe you were never watching porn with each other. Now you got to watch porn with me so I can, excuse my language, get off.
Yeah.
While you watch me get off on another woman.
Yes. Yeah. But this is about value system, right? So it is that each human, each human being has to have a value system. And for those who are parents, make sure your kids know what your value system is. Don't think like they just know, oh, we all doing the family. They know we don't do this, we don't do that. Well, did you have an updated conversation with them?
Right. Exactly.
Yeah.
Mommy and daddy changes. We change it, but did we go back, right? And have them family meetings and say, like, when we said the emergency plan was so and so.
Right.
It's changed.
And
right?
like I said, and you should be having an emergency plan. Glad you said that, because you definitely should be having an emergency plan with your kids. You never know what they may be in the situation.
Yes.
I have a lot floating around in my head. So many directions. I think one of the things, just going off of what you're saying, Azali, about family value systems, and not necessarily just doing things with your children out of habit and routine, but really explaining what this means to your humanity, what this means to the love that is central to this family. I guess I wanted to ask you, Karen, just how important is it that we are first teaching our young people about self-love, right? About understanding their bodies first and foremost. Under even this is a new thing that I'm exploring, but just personifying your body system, right? Making it a friend and really kind of saying, well, heart, that's my best friend. This is that, like just really breaking apart pieces of your body and saying, like, and really personifying what part of this body, what does it do for me? How can I grow in love with this part of my body, right? So how important is it to teach, get to know your body, love your body, so that when somebody try to come in and try to violate your body, right,
Mhm.
you
Yeah.
love it, right? And so then that natural inclination to say, no, stop. No, I don't like that, right? I have a toddler. I'm teaching her, no, I don't like that. I'm teaching her that early, right? Because I think it's important for her to love her body enough to know when it's enough. I don't feel like you touching me, right? So
Mhm.
can you talk some about that?
Yeah, definitely. One of the good things I like to do is, I mean, sadly enough, in some of the schools, you can't really say a lot inside the schools, but throughout the summers, some of the places allow me to go to summer camps. So I try to talk to different age groups in the summer
Mm,
camps. And so one of the things I definitely just from the very beginning with some of them is talking about, guess what, girls, your body's going to be changing. You're going to actually get a period. What is a period? Letting them just learn, just even from the very beginning of what's going to be happening to your body and the different things that's going to be changing in your body, where you were flat chested, now you got a chest. And sadly enough, for some people as a young age, some grow faster than the others. So you get teased and they get sexualized in elementary school, some of these girls that I'm dealing with, because their breasts are large in elementary school, and so just being able to allow each person and telling even the men, like even same thing, that they feel uncomfortable with themselves because their penis is maybe really tiny and
Yeah.
some are larger than the other. So it goes in so many different directions. So I have to talk to both male and females, and I try to sometimes either separate them or sometimes have them together so they can understand the other side of it there too. Is, just like with a man, a boy, where he be talking like that, and all of a sudden he has a deep voice, he's growing,
Yeah.
so guess what? Your body is also growing. So I kind of explained it to them in the voice section kind of a way too with them. So it's simplifying what's happening to you and how you need to love on that body, that's because that is your body that was given to you, and how are
Yeah.
you going to take care of that body,
mm,
and it goes even to the thought of even just health wise, how are you eating to keep that body healthy as well.
Yeah. Yeah.
But the main thing is to love on me. I want to take and love on me, whatever this body gave me, whether it's a small, tiny body or a bigger size body, it was
mm,
given to me to be taken care of. But how do I do that? And so sometimes
mm.
I want them to sometimes tell me what are their thoughts. So it's hearing so I think a lot of times parents can't do all the conversating. They need,
Yes.
like I always tell parents, I will buy you a box of Q-tips so you can clean out your ears, because there's some things you may not want to hear. So let's clean out
Yes.
your ears so that you can hear what your child is saying to you and what they're hearing from their peers. And maybe helping them answer some of the questions that the peers are saying. They're saying it all incorrectly.
Yes. Yeah.
So I think it's
Mm.
letting the child feel comfortable. And if it's not you and you don't feel comfortable to be with you, maybe it can be cousin Jody you can speak
Yeah.
to, or sometimes they go to after school program. Sometimes the after school program, the parents allow them to be able to talk to them there, or as well as come to us for us to be able to talk. But find somebody that they feel comfortable and you feel comfortable being able to hear what the child has to say. So, because part of that love is not you keep saying, "Oh, baby, you're beautiful, baby." No, no, no. Speak to me. Talk to me. I want to hear you. I can't
Mm.
talk to you. You got to talk to me, and let me see how
Yeah.
much. And I learned a lot, even just that with my own kids. I let them sit and, we lay down in bed and was telling me things, and it was,
Go.
Yes, it was a lot.
but I listened. And so now
Yeah.
they're able to talk to me and being able to say anything to me, and especially being in the field that I am in, who am I going to take care of first? Yes, I want to take care of your child and your child and your child, but I need to take care of my children first.
Yeah.
Yes.
Yeah.
Yeah. But I like what you said, simplifying, because I think that is the difficulty for us as human beings. Because when you have parents with trauma raising children that they want to keep innocent, that's also going through their own trauma, nobody's talking to nobody. We all hurt out here. Like, you know what I mean? We all hurt. Parent is saying, wait a minute, I'm still trying to grow up and get some stuff together. Now I got to go have the conversation with he or her, but they protected because I made sure they didn't go through what I went through. So is this very uneasy situation that's there? And if nobody's making the move to even, like you say, simplify and just try a little conversation, then it's like we're really not getting anywhere. We here nursing hurt because
Mhm.
ain't nobody saying nothing. And then
Yeah.
it'll be a stranger outside that says, oh, I'll handle this, and have
Right,
that conversation you were supposed to have and mess it up even more. And you're like,
right.
oh, now we got to do big investigation. So I like that
Yeah.
you said simplifying that, because for me, this is where the rubber meets the road, where sometimes being your kid's friend doesn't pay off. You have to kind of figure out when you go to kid friend part and make sure you did the parenting part, first, because sometimes we rush over to, I just want us to be close and tight, and my daughter be my best friend, or my son be my best man, and all this situation, and you rush to friend, and certain conversation you should have had doesn't get have certain value I should have talked to you about. We never put on the table certain moments or rites of passage we should have had. We were so busy hanging out and having fun, we never talked about that. And then life starts happening to your child because he or she is now an adult, young adult, and now we're like, oh, well, let me set the record straight. It's not that mom and I never argue, but what we try to do be respectful. So we do have some things that we had to grow from. But you never had that conversation, and kids think like, oh, mom and dad was gold, and my first relationship is going to be just like that.
Right.
Mom and dad had basement church
Right,
while
right.
you
You
was
weren't kidding. Right.
while you were asleep. There was basement church because
Yeah.
we were having some deep conversations. So I love that.
Mm.
Simplify the conversation, because you have to have the conversation, and you need to, in most cases, be the first one to have the conversation, not always be the one to have all of it, but please try to be the first to
Mhm.
start it,
You start that.
right? If I'm hearing you correctly. So love that. Miss Sounds, go ahead with
Yeah.
that thought.
Well, I want to say that's
Yeah.
one of the great things about Miss Sounds. I'm glad that you're already starting with your child, being able to say no and being able to understand the reason and why it's going to be no to some of these things. So starting at a young age is what I always say to everybody to don't wait till they're even in elementary school. It's too late. Start from
Yes,
earlier
ma'am.
than that. So thank you, Miss Sounds.
Absolutely. Absolutely. It's essential for me to always have her connect to her body, right? If it's telling you it's too much, I don't want this, I want her to be able to articulate that, even to me, right? If this is, I don't want no hug right now, she don't want no hug right now, right? But um
Like, she
um
real clear. No, let me
He'll be
yeah,
very clear with you.
not right
she's
now, but I'm
looking
your
at you.
mama, so I'm gonna hug you
Yeah.
later. But you know
Yeah.
what I'm saying?
No, she
I'm
take the love
focused.
from her mama, but from a stranger, she's like, do I owe you money? I mean, that look.
Exactly. She get that look. Y'all know her. So she um but just going off Azali's point about just being even as a parent, being a bit squirmy about having the conversations, and even what you were saying, Karen, just like it's a little uncomfortable to talk to my child about this, right? How much of that could also be our lack of education on what
Mm,
our body systems are actually doing, right? Because I'll say in our community, a lot of our conversations in our households around like sex is don't do it. And when
Right.
and even the period, like the period is coming, it's often linked to having a child. It's never like just the period, right? It's never like, your body's gonna go through this and then it's don't come back pregnant because now you got your
Fact.
period, right? So can
Exactly.
you
Facts.
demystify some things for us to really, seek that education, and really, if we can seek that education, we can simplify. The
Mhm.
reason we have to overgeneralize is we don't really understand.
And that's where sometimes too, it's good to get educated your own self. Like I said, to be able to educate your child. And again, that's why I said, and if you're feeling uncomfortable, find somebody you trust enough. Like I know my kids used to have some of their kids come and speak, their friends come speak to me, because they know I'm going to be honest and open, but they also know, but I also knew their parents knew they were speaking to me, but I also made sure they heard in front of me that I'm not going to tell the parent what you're saying
Right.
to me, so that you can trust me enough to be able to say, and I'm going to be professional, but I'm also going to be a mama kind of a thing too, to
Mm-hmm.
Yeah.
you know what I'm saying? So, but it was again, hearing what they had to say, answering some of the crazy mystified questions, because some questions were like, where did you hear that from? You know?
Like, child, what are you talking about?
Right, exactly.
Yeah.
Ain't no way come close being any what you're talking about. So tell your friend, come see me because he's so wrong, he wrong. You know?
Yeah. Yeah.
So,
Yeah.
it's
But this is where community impact is important,
Yeah.
because I want to crystallize the point of what you're saying is that we all need one or two people on the side traveling down the road with us. Ain't got to be lockstep all the time, but traveling down in the same direction, so that if their children need to tag me in, it's cool. If my children need to tag them in, it's cool. But also that the adults in this circle, like we having conversations though.
right.
Yeah.
Right. So again, it really comes back. I just want to connect this to community impact, because a lot of our conversation, especially going forward for the rest of this year, is really tying together our personal development individually, all of our guests coming on, and what is the community impact. It is beyond just educating and having these conversations just to tie up our time. That's not it. But it is to say that a lot of the issues that are in our society that are making structures hard to build is because when people tag team, we're not having a central conversation that are continual. We start a conversation. Like I'm just telling you, when I spoke to Karen and when we did our pre-interview and then when we came online, like her stuff impacted me, because I was like, wait a minute, Azali, go read some more and see what's current. Like I had to take that on my own self.
Yeah.
Miss, no, I was still like in shock weeks after the conversation.
Frozen. I'm
Yes,
like,
ma'am.
is
Oh,
everybody there?
right.
One of the things I
Caricature.
tell people all the time, because I say it even about myself, continue to educate yourself. Something new always comes down the road. You don't know how many times I still go to these educational meetings on HIV, on STDs or whatever, because I come in and I'm like, really? And I learn always something new myself. So then
Yeah.
I can bring it out to the community. So that's why I purposely go into these meetings, so that I know that even if it's just one thing I learned new in that class that
Yes.
day, it's that one thing I learned, but I'm taking that one thing and I'm spreading that word out
Yes, it's
there. So
important.
always
Yes.
continue to, don't lock yourself in a box and say, I already know about this. I did. No, you don't, because guess what? Some like new medication is just coming out on the market again. You know what I'm saying?
Yes.
So things are coming out constantly, and you should always continue to educate yourself.
So I'm going to tell you of something I've heard, and you're going to tell me if you know if it's a fact. And if you
Okay.
don't know it's a fact, we all need to go investigate, because I just heard this today before coming on, and I'm still trying to digest it because I don't know if I want to accept it, but it makes sense. So I was in a conversation with someone else, and they were saying to me that one of the things that they've found, because they have teenagers they're raising, that's shocking, and this is a dad, was that there is new study coming out or already on the market that says for women especially, they have found that women do have DNA that's male DNA that's within their bodies. They used to think it was only for the mothers who were having male children that there was a remnant of the DNA left over because of the development of the male child within the womb. However, they're saying that as they start looking into women and the bearing and rearing of children, that they're noticing that the woman just has male DNA in there. And they're wondering also that when you have several sexual partners or experiences, could there be leftover DNA from those transferences?
Ooh.
Well, heavy.
Well, definitely, you know, when you're having sex, you know you're having sex, and I express how I say it, but you really are having sex with Tom, Dicks, and Harrys.
Yes.
So you are, so, you know, there's definitely remnants that definitely can be left over. So you're having sex with other men or women or whoever, you know, because if you're a woman having sex with a man, you have the remnants of that other individual. If they had it, say 2 days ago, there is remnants still in there that you can be having it. And I tell people that all the time. That's why I even talk about with the STDs, and I show what some of these STDs look like. And again, not to be rude, but when you have an oral sex, you're eating that other person's DNA.
Right. So y'all just listen to that. Ain't nobody trying to stop your fun. We're
Right.
just saying reinvestigate some of this fun terminology you're using.
Right.
Because fun,
a lot of people.
Fun was a word for us to have these temporary moments of satisfaction and pleasure that can be replicated in different moments. Y'all trying to have these moments forever and then and getting stuff left behind forever too. That's trying to take you out of the forever life.
Well, that's how even the STD even comes about. Because remember, you know, how somebody else had it and gave it to somebody else. So now you're enjoying that individual and you're getting that other person's STD. You know,
you don't want that gift. That's not the gift you want.
That is not a gift that you want. You know what I mean? And if you know that some STDs are curable and some STDs are not curable. So, you know, chlamydia and gonorrhea are the number 1 and 2 most common STDs that people can get. So people don't, and again, sometimes I hear this, especially with teenagers. Oh yeah, I had chlamydia once. Yeah, or I have, and they know some of them have it, or some of them don't know that they have it, but they don't realize how many times you keep getting it. You're tearing down your body, tearing down the cells inside your body. You're opening yourself up for more STDs to show up quicker or HIV to show up quicker. I kind of use that in the sense of somebody, like a woman, gonna have a baby. You have sex without a condom, and the sperm goes inside of you, and you give a nice, easy access for yourself to get pregnant. Well, that's the same thing you do when you're breaking the cells down to give a nice, easy access to get any of these STDs. You know, and I have a lot of people that they will come. And like I said, I try to explain to some of the providers and choose when somebody comes to say, oh, my partner told me I came back positive for chlamydia. You don't want the provider or yourself, you as an individual, say, I don't want to just get tested just for chlamydia. Test me for everything, because I know quite a few times, I know some of the other partners, and the other partners had something else. And so they're only going to tell them the one good thing, because chlamydia is like, in a sense, the good STD to have, you know? And so they'll just tell them, oh, I came back positive for chlamydia. But then you get tested more, you find out they may have herpes or syphilis or whatever else. So, you know, you want to get a whole full panel and make sure that you check yourself a lot. And part of our problem is a lot of young kids, back to our teenagers, our babies that we love, are having sex. But guess what? They're not getting tested. They're having just sex. They're having condomless sex. And either some of them are coming back pregnant, or some of them are but again, they're having an STD, but again, they don't know what an STD is. So they're going to sit there and have the itchies in their vagina and not understand why they got these itchies in their vagina.
Yes. Give us the definition again, just as a reminder. STI versus STD. What's curable, what's not? Just so that we can come right back on with you.
All right. So what basically what happens there too is like it says, STI stands for sexual transmitted infection. STD stands for sexually transmitted disease. Basically, it means somewhat the same thing. And STD is an STD, period. But sometimes people like to say STI because it sounds a little bit more lighter because it's an infection, not a disease. So people don't sometimes like the word disease. So then what happened is you're able to get cure, you're able to get treatment for some of the ones. So you for like say for chlamydia or for gonorrhea, syphilis, trichomonas, you're able to have a treatment to be able to get that. And a lot of times it's just a pill that you'll be able to do. For syphilis, it's a different story. You're able to get treated for it, but it's an injection.
Ooh.
It's a nice, long, beautiful needle
No, ma'am.
go inside your butt. So
Okay.
what happens is with syphilis, at least, you know, that's one of the few that is like that. And depending how much syphilis you have in your body is how many needles you need to get. So if you have a lot of, if the lab shows that you have a high amount of syphilis inside your body, you would have to come in 3 weeks in a row, like say on a Tuesday. So this Tuesday, you have to get your first needle. Next Tuesday, you get your next needle. And the following Tuesday, you got to get your next needle. You know what I mean? So you can either get one shot or you can have to get the 3 shots. And like I said, by the time you finish with the 1 shot, the second one is ready to come. Your butt is still hurting you. You know what I'm saying? So so those are the treatments for that there, you know, like for an STD or anything like that. HIV, we know automatically there's no cure for it yet. Is it coming down the road? I'm actually been hearing a lot of different things that's been, you know, it's coming down the road, you know, but I think also a lot of it is money making business too, but don't let me start on that part there.
Yeah. And then there's also herpes that you said is not.
So herpes, right? So herpes, you have it for the rest of your life. Okay, so there's herpes 1. So it's herpes simplex 1 and herpes simplex 2. But one of the things, a lot of people see that, which it is, herpes simplex 1 is supposed to be oral. So if you have a cold sore or anything like that, you know, you can say, I have herpes 1. But then herpes 2 is supposed to be genital. So you could have genital herpes. But screech, you can have herpes 2 in your mouth, because if you ate somebody that has genital herpes, where you're not thinking, oh, it's my cold sore is only herpes 1. No, it's really herpes 2 because you had it inside your mouth. And again, the person doesn't have to come, it's the fluids. Okay, so people say, oh, the person didn't come inside me. And okay, so it's the fluids. So, you know, so you can have the herpes 2 inside your mouth. Again, another way of thinking about some of these other things is, and any of it could be chlamydia, whatever, which I know you didn't like when I said it before, but if you're having that sexual thing and the guy decides to want to squirt, and he squirts you in your face and he squirts you in your eye, again, you got fluid in your eyes. You got fluids in your nose. Okay? You can get a STD.
I just was shocked when you said it. Okay, I didn't like it either. Okay, but it's just a lot. I'm just like, oh Lord, in my eye. What?
Right.
Because we're playing with our lives out here and then saying we want to live the best life. What? Watch your choices. I don't know what to say.
And I guess especially a lot of the teenagers.
That's for me too. Yeah, that's for me too. I'm saying watch my own life, right? Because I want to model the thing that I want my children to hopefully adapt to most of it. They don't have to adapt to all of it. They're individual. Don't get me wrong. Because I don't want to be puppeting my children.
Right.
No. However, I need them to know the part that mom says no, the part that dad say no. Even I'm a single mom, I'm still trying to uphold, like, you know, the daddy still got some rules. I'm still trying to make sure, you know, yeah, your dad would not go for that. Okay. You know what I mean? So yeah, trying to have a balance. Right. Trying to have a balance, but it's unpleasant to think of, you know, losing my eye over fun.
And again, it just, the main thing that I get at to say to anybody is just continually getting tested. If you want to be inside of this kind of experience, fine. When you first started off, get tested. If you know you want to continue on, again, we have medications out there. Like I said, I'm the sexual health prevention coordinator. So I talk to people about PrEP and PEP. So if you know you're in a situation where you had sex the night before and the person may think they may have HIV, we have PEP, which is a medication to help. It's a post prophylactic medication that, again, is after the fact that you had the sex, then you would take it up within 72 hours of having that sexual encounter. For 28 days, you would take this medication, and it's 99% effective, being able to keep you remain HIV negative. Same thing as when it comes down to an STD, we have something called DoxyPEP. Basically, it's the same thing, which we use an STD medication that be able to help you do that. And one of the things I wanted to remind people again is, because again, we're talking about our teenagers. Teenagers, our beautiful babies, count for half in the United States of the STDs in the United States. Half the amount is our teenagers, ages 15 to 24. Okay, and that's what we know about. Okay, and remember, we're able to HIV test at age 13. So again, some of the parents don't want to even do that. But there's 9-year-olds having sex, there's 11-year-olds having sex, and so it's what we only know about, and that's the scary part. So that's what I'm saying. Where a lot of girls were the young and they were told, let's go in the basement and go, play around with each other in the basement with the boy. And even though he don't realize he has it either, because he might be a young kid, not even realizing he has it either. And he's doing the wiggles with the girls inside the mouth, inside wherever, whatever, and they don't know. And then 2-3 weeks down the road, they keep, they having all these itchies and they can't understand why they got the itchies. Yeah. And if you don't get it treated, it can get worse for them.
No, that makes sense. And as a reminder here, because while we're talking about, in most cases, people agreeing to do this for fun, we know there's another darker side. Those who never gave consent.
Right.
Okay. A predator made them a prey.
Right.
Just because he or she could. And it's not just the dudes out there doing that. They got women who do that. They have women who violate their own children or other people's children.
Right.
They rape them.
And that's the scary part. A lot of times it comes down to Uncle Joe was the one that did this.
Right.
Or Aunt so-and-so wanted to make this person a man at age 14.
Yes. So let's just make sure you guys understand that we are saying that the evil we're talking about, I'm going to call it evil. I'm going to call it what I call it. I came here to have organic conversation with people who were courageous enough to have the conversation with me. Karen is one of those people. She's courageous enough to know I'm going to call it what I call it. So the evil we're talking about, there's yet a bigger evil, a darker side for those who are raped and violated, right? And end up having these things, growing up with them, already have an identity issue because the people who cared for me took something of essence from me, didn't even give me a chance to make my own choice. And then I grow up and they never got me tested. So I'm growing up with this stuff, already struggling with my identity. Then I happen to go to the doctor and find out I have this stuff. And I'm like, well, I've never slept with nobody voluntarily. I was raped back at 5.
Right.
And they've been living with this stuff. Miss Karen told us that stuff can live in your body for 10 years before it show up. She's mentioned that on our last conversation. So, I was listening because as she's talking now, I'm seeing the correlation of, oh my goodness, we're really destroying ourselves and our youth that could come up to take us forward as a nation, because when we are taking away, violating them and doing this kind of stuff to them, and then they're finding out years later, what do you mean I have HIV? What do you mean I have herpes and such, when I have never voluntarily given myself to anyone? And that rips them down the line even more when they were already trying to figure out, why am I here? What's my purpose? And what am I going to give to the world?
And I know one of my coworkers actually just told me recently, and I swear, I think I want to punch. Anyway, Anyway, but they were telling me like a situation that they had just went through with one of their clients, and basically a lot of it felt sadly enough in place of the mother, where she has a boyfriend. I love him, but that's okay that that boyfriend can beat up your child or molest your child, but he loves me and he wants to get back with me and he wants to this me. And this individual continued to, until it was now found out, that she was allowing the boyfriend to do all of these things to her daughter. And, you know, and the only reason why a lot of it came to light is because they found, you know, bruises on the child's body. And then they had to do other things and had to do a rape kit and all of that to find out. And she continued to allow him to do this. And, you know, even though she fought, I heard she fought him a few times, like, stop, get away from me, but whatever. But she went back to him and put her daughter back into the same situation still.
Yeah.
And during the drunken time, again, alcohol and whatever, that's what I'm saying, alcohol and sex, you know, his alcohol ways is, I need to take it, I need a little girl.
Yeah.
I don't
So
need
that
mama, I
makes
need a little girl.
the mother responsible. I
Yes.
understand we always want to go through and look at the actual violator. They are both responsible. Like, period, end the story. They're both responsible for that, for in that situation. And as a reminder here, because I'm just thinking even for my own self, we have to reevaluate how we apply the word love when we constantly hug hurt. When you're hugging hurt, like just
Right.
loving on hurt, that ain't no love, baby. That is confusion. That is confusion that you have accepted as love. It's not. And it's not that love does not hurt, but it should never be a daily, every moment occurrence. And it should not be a violation of your value and those closest to you.
And I want to definitely bring it out again back to our teenage again too, that, you know, with part of their loving, when you're saying that when love hurts is especially, you know, the two things that I want to talk about is, like, you know, especially it's happening in the schools all the time, is the sexting.
Oh,
Where,
yes, ma'am. Please go there. I forgot. Please go there.
know, so, you know, I want to be able to, you know, they're saying, you know, let's, you know, once again, the boy may be saying to, I don't want to put it all on the boy all the time. Okay. I'm
Yeah.
just saying it as an example, that, you know, I love you and show me a picture of your vagina, and you taking a picture of your vagina, or you taking a picture of your penis and you putting it out there on a text messaging. Texts are not, you know, they're open season. Anybody can get a hold of that text. Whether you put it out there and gave it out to other people, it's, you know, these, everybody talk about AI, it can get back, it can get in other people's hands, you know, and that's how a lot of some of these even porno, you know, things occur and stuff like that. So putting it out there, you know, and giving it away, and then they may be shown in your body to the whole school.
Yeah.
So, you know, we're just saying, you know, don't, if somebody asks you to take a picture of yourself and show it to them, because I love you and I want to be able to go off on you while I'm laying in my bed, tell them to go find them, get their own magazine or whatever. You know what I'm trying to say?
Yeah.
But don't
Yeah.
ever put yourself into that situation, because you're putting your body out into the atmosphere for lots of people to be able to get. And now the other thing that I know that happens a lot with the teenagers is called love bombing.
Talk about it.
Okay. And so love bombing is basically somewhat, I kind of talked about it again too, is basically they're going to be saying all of that. I love you. I want to be with you. And if you don't do what they tell you to do, they're going to be like stalking you. You know, no, you know, I can't take you no more, and I don't want to be with you no more, but they keep coming after you and bombing you with, like, you know, I'm loving you. I love you. I love you. What, you're not gonna love it now? I'm getting angry now. I'm gonna be, you know, coming out even more so, and I'm gonna get you back, and I'm gonna, you know, monitor you. Like sometimes they will, a lot of times it happens in sex trafficking, in the sense that they can't go inside a doctor's office by themselves. They got to go in with somebody, and they got to talk the story, and we're like, oh no, we don't want to hear you, you got to go. You know what I'm trying to say? So,
Yes.
and they sometimes already schooled on what to say to the doctor for
Yes.
certain things.
Mm.
You know what I'm saying? So it's, that a lot of times happens, that if they can't be in the room, if they come out and something else is being said and whatever, and you didn't listen, they're going to get beat up
Yeah.
afterwards.
Mm.
That's slavery and manipulation. Let's just
Right.
call it what it is.
Right. So,
Right. It's the same
Yeah.
as bullying. What you
right.
think bullying is manipulation, right? Regardless of whatever level it's on. It's manipulation. And I'm gonna go out on a limb and I'm gonna say this because I really hate the bullying thing. I dealt with it growing up. And then I think at some point in my life, I became a bully too, because I was so hurt. I didn't realize I was being just as evil as what I was coming through. And I'm way, way, way more in tune to that, where I'm like, yeah, certain things, Miss Karen, I'm like, yeah, I'm not gonna be a part of that. I'm good. I'm about to leave. I'm not gonna be a part of it, because if I stay in this room, the whole atmosphere has to change, because I'm not gonna put up with certain things. But let me say here, with the whole bullying situation, I believe, me, Azali, Lady Lee, by herself, not anybody else here, that most bullies, not all, most bullies are just hurt people looking to hurt somebody else because they don't know how to move on from their hurt.
Right.
That's just me. That's just me. So if you're trying to come to bully me, you're about to fail, because I see you only as a hurt person. I don't see you more powerful than I am. I see you're a hurt individual, and either I'm going to help you or I'm going to leave out if it's something I don't want to handle.
And I know right now with me, I'm actually starting to go into the colleges. Like I actually went into one last week. I go into one next week again, where they have me going around and especially talk to the freshman class, because those are fresh meat.
Yes. Yes.
Freshmen are fresh meat.
Yes.
And, being able to talk to them about everything that I'm talking about right now is what I do talk to them about. You know what I'm saying? Because you're put into a situation where, you're away at college now, you're away from mom and papa right now, and you might be, there. And I'm able to talk about it because I remember in my freshman year being fresh meat. And I know, and I'm able to talk about it. I wasn't able to talk about it for quite a while, but I was almost raped when I was in college.
Mm.
And I was put into a situation where, again, I'm going to hang out with my friends at a party. And I was and luckily, like I said, the word was almost, because it didn't happen, because a girl can fight.
Mm-hmm.
But as a freshman, they see, again, some of the sophomores or juniors or seniors seeing the fresh meat come in town. So let's get to them. And let's try to basically, make them the next sexual target.
Yeah.
And again, to me, I was hanging out with like juniors and seniors and going out to the parties, thinking, again, well, I'm going out to have fun. Like we talk about it, fun.
Yeah. Yeah. But that your at that time, fun was really supposed to be clean, and we all got each other back, right?
Right.
They have used that word fun, and baby, it is not innocent and nice anymore. It's a setup for a mess.
Mm-hmm.
It gets messy real fast. I want to throw in something I like to do out of the box, a bit controversial. Okay, that's what it is.
Let me get ready for you.
I'm growing and I'm trying to deal with some topics because of my Christian belief that I used to stay away from. And I got to open my eyes now that I'm mama. Okay.
Mm-hmm.
So, how do you deal with this in a setting or with an individual that is faith-based? I'm going to leave it as the word faith-based.
Mm-hmm.
Like these conversation of either dealing with sexuality and getting themselves together or their children. Have you had to deal with that?
Oh boy, too many times. Too many times I've had to deal with that. And it becomes difficult. And again, depending on who you're speaking to and what exactly you're trying to say there. But that's where it gets, again, sticky, and having to say, you shouldn't be talking to my kid about this, or you shouldn't be doing whatever. And, sometimes, again, it's trying to educate, again, you're supposed to be an adult. Like you're saying, I have to be an adult. I have to grow up because I got kids. some of them have to grow up and know how to do that. But then in a faith-based church, because I know growing up in a faith-based home, I didn't know jack nothing.
No.
And I had to learn all through the streets. And, some of the things I learned wrong too,
Yes.
where I don't want other people to be able to have that happen to them. And so and especially when you talk to the older generation,
Yeah.
that's when it becomes a little bit more difficult. But then I also, again, being in a faith-based home all my life, I can throw scriptures at you too. Like you want to throw scriptures at me, I can throw scriptures right back at you.
Right.
And again, a lot of it again is trying to say, we're supposed to be loving on everybody. Love thy neighbor. Taking the weak, the poor, the meek. Love on them, help them, give them food. Jesus said, you gave me food. And when did I give you food? I don't remember doing this for you. When you gave it to somebody else.
Mm-hmm.
So like I said, like you want to throw at me, I can throw right back at you too.
Yeah.
But it's just shown it in a, I'm not sure what kind of word I'm trying, and not saying a nice way, but again, it's just trying educational way,
Yes.
of saying that, if, we have a lot of people that has left churches throughout all of the United States that because, maybe they landed up being now in the LGBTQIA plus community.
Right, because it's a lot. Yeah.
It's a lot. And the letters keep going to that's why they say plus, because the letters keeps going. And has left the church because the church didn't let them feel welcoming.
Yeah.
And, it's a catch-22 to all of that. So it's knowing, there is still a faith base, you still whatever, but it's also, I need to take that person's hand and have them being able to feel comfortable to be inside church because again, we're living by neighbors. And whether it may be, and again, it doesn't even have to be that. It could be, you could have been a murderer. You could have been a thief. Sin is in God's eye. So no matter what it may be, and what you may see as sin and what maybe somebody else may see as sin may not even be the same thing. Because if you didn't grow up into a faith-based home, some things you may not see as sin. It's called, I'm surviving.
Yes. But giving the knowledge, regardless of the classification, the lifestyle, or the identity of the person, is where you feel that your responsibility is. It is to help them to be educated so that they can make a sound judgment and decision to better their health, period, at the end of the day. So that's what I'm getting. Miss Sounds, you are quiet. What you, round us out. This thing is so good. We stayed on here longer than we needed to, but let me tell you, the education is so real that, we just wanted to take it all in. Miss Sounds, I want to hear anything you have to say in reflections and or question on this. I think this was, I learned some stuff. I ain't gonna be stuttering on here, but I'm just saying a little bit more shock is coming over my head.
Y'all take my quiets for more of a reverence for the severity of what we were speaking about earlier about perpetrators and prey and things like that. I really wanted to give the space for that conversation to happen, and give reverence to it because it's a real thing that affects real people. When it comes to what I'm thinking about through all of the stuff, I just wanted to really touch on sex education, right? And for me, I see it as, I don't know how it's being taught nowadays or how it's being communicated, but I remember it being a very sterile kind of situation where there was no life in sex education. And it's all about life. Like sex education is all about life. And there was no life. There was no intention in it. It was just really to communicate words and put extreme boundaries on people. And so I wanted to, what do you think about this, Karen? Because again, this is a new exploration for me as an adult to really personify my body, right? Meaning I befriend it. And how I befriend it is I give a face to the parts and the systems that keep me alive. So my heart is a friend to me, right? It's not just a thing that beats. It's a friend to me that wants to keep me alive. And how I guess I'm thinking about how much of that should be infused into heart sex education so that people really see that your body is your friend. And when things affect it through your choices, your friend is being harmed. This is not just some abstract thing being torn down. The actions for people that are actually taking these actions. I'm not talking about people that have been perpetrated. That's a different
Yes.
system. But for people that are willfully taking these actions out of quote unquote fun and the lack of fun that they're having, how much do you think is important for us to make our communicate that our bodies are really living, breathing things that are friends to us that we need to treat right as the basis for sex education?
I think it's so valuable. It's unbelievable. Sadly enough, sometimes it's when you sat in that boring class, it's because the Board of Education said this is what you're allowed to teach.
Yes.
Yeah.
Yes, ma'am.
So that's where part of it does come from. And so sometimes get into to Albany and say, cut the crap, let it be whatever. So I know, when that's why I'm happy to sometimes, like I said, I am able to go to summer camps, I'm able to go into colleges and I make it fun. But I want to make sure that they know that I'm telling them all these educational things, but I'm making it fun and healthy and safe. But take care of yourself too as well. So like my classes are not boring. Like I even teach them how to do condom demonstration because Lord, I know that people don't know how to put it on properly. You know what I'm saying? They say they do, and especially a lot of the guys don't. And like I says, I joke I get joked on at work because I literally have a plastic vagina and I have a plastic penis. And I'll be walking around work like, hey, people know me as doing that because they know I'm going to have fun. But I also try to make it education and teach people to put it on correctly. Like I said, I'm going into the colleges. I'm going to be doing all of that. The freshman classes, the dormitories, everything, they're not having me even going into classrooms. They're bringing me to locker rooms. They're bringing me to dormitories. That's where the dormitories, that's where it's happening. Sometimes happening in locker. So they're trying to step out of the box and make it a little bit more educational for me to be able to expand on what's happening to them. Like I said, especially the freshmen and especially, and like I said, athletes, athletes are very much sex objects.
Yes.
People, and so I'm the quarterback, and so I'm going to have all these females because I'm the quarterback, or I'm, the head person on the basketball team, or whatever else like that, but just showing them that, take care of yourself first, love on you, because you're going to be the one walking around that campus as well with your name out there, and they're going to know who to contact.
Yes. Yeah. Yeah.
And we don't want you to be the contact person.
Yeah. Yeah. It makes so much sense. I want to do 2 plugs here because I always like there to be clarity. The one plug I want to say is this. We are having an extreme conversation, and I don't want anyone that is a subscriber to Raise Voices to think that our laughter is outside of us taking the conversation and the knowledge seriously. Some things are shocking. And so we react in that way because it is shocking how much people are participating in these fun things that are not understanding their consequences. That's all we're trying to say.
Well, and to add to that, because I know you kind of broached on it earlier before, is when I get back again to the word testing, is, where did you have your party at? So that's where you want to get tested. So I just want to remind people, if, you need to be very, very, very open to your provider. A lot of people are not open to their provider and don't tell the provider everything. And so if you've had oral sex or vaginal sex or anal sex, we do 3-site testing. We want to be able to test everybody. Again, you can have a STD in your anus. You know what I'm saying? You can have it everywhere. And wherever you had it, we need to get that spot tested to make sure that you're safe. We're trying to do it not to be curious and not to say, oh, really, I did anal receptive, I did anal insertive, there's so many different things. I did masturbation. I talk about it all to somebody because I need to know, and I'm not saying it just to have fun with it. We need to know what you're doing to know how to take care of you.
Yes, that's the point. I can't help you if you don't help me help you.
Right.
Like literally, I can't. She can't help you unless you tell her all that she needs to know and trust the confidentiality of that and trust that she's going to tell you what can and cannot be done to help you. Like, period. The other thing I want to say this to parents, and please comment, engage. I believe that half of our problem as to why teenagers are out there doing all this stuff is that we do not have our teenagers doing enough to keep their time occupied for them to really start to carve out their selves in life. Part of this is you do have single parent homes that they cannot be home with their teenagers because they're out there hustling, working, whatever. But some of it is we do have parents at home who are not checking in on their teenagers. They're not sitting down and doing a craft and saying, well, hey, Rob, what do you want to do? Okay, you want to do video editing? Yo, come with dad. Let's go down to the basement. Let's see what I could do. Let me teach you this. We're not doing that. Your daughter want to be in fashion design, get her something, buy Canva, let her start designing stuff, buy a little sewing machine. It's so much free space and free time that some teenagers are going to find
any
something.
of that, when you're saying your daughter's wants to do fashion design, whatever, in that too, have that fun time with them as they are doing their design, but then still can be able to talk. Do you know within that fashion field how things are in there, and they can be able to, rape you or do whatever? I mean, you hear it. There's so many shows out right now, reality shows that Nickelodeon or somewhere else, people got, violated on
Yes.
set of some of these TV shows. You know what I'm saying? So it's within any of it, and there's something, work your way in to continue to educate and say, I'm here for you. Talk to me. Find that time. Parents need to find time to talk to their kids and I know a lot of kids are going to be like, okay, it's okay, mommy, I don't want to say nothing more, blah, blah. But get them comfortable enough to be able to talk to you, and again, or find somebody that they trust to be able to talk to.
Yes, I agree with that, because they're while they're doing a fun activity, right? You can have a simple conversation. You can test the waters to find out what's probably percolating on their minds and figure that out. Like, my kids already know certain shows. I don't care if it's on Disney Plus. Check with me and see if it's one that I want you to watch. And no, you do not need to watch something that's not age appropriate. Like, live your best life in the age appropriate field.
Right.
Before you got to step up too soon and crash your little identity that you just get in. So I'm really careful about that. There's certain shows I don't play that with my children in the room, right? Because first I got to even know if I really want to watch it, and then what is it saying? And then I don't want them in the middle of that. I just want to deal with me,
right.
And my true feelings about that show before I just have them walking in and out the room, not knowing what they grabbed back and forth. Like, I just want to be so careful with that. Right. And then some show I just got to turn it off because this definitely is not for you. Is mommy trying to get some knowledge? So I'm going to shut this down to you. Absolutely not coming in the room, and, and deal with myself after. So I just want you guys to understand that while we bring this topic, we're also saying that we're watching our own selves in the processing and what we're letting to come in, so that when we have to dialogue with not only our children, but our children's friends, neighbors, people in the community, that one, we have the knowledge, two, we have the right to say something, and three, we know the way we want to say it to make sure that there is a positive impact versus a negative. That's what we're
Yeah.
saying. That is what we are attempting to do. Listen, we hope that you have enjoyed this as much as we've enjoyed it. Because if you didn't have fun, let me tell you, even though you see no popcorn, learn some stuff, and I'm less shocked about certain things, that means I'm getting into acceptance. I ain't saying I'm not shocked, but I think I'm going to sound like I'm 75%
Yeah.
retrained to
Yeah.
accept that these things are happening maybe next door to
You
me.
said these things. Why you pointed to the eyes? Okay.
Right. You see that? I'm only 75% there. I have not got to 100% of this new classification of fun because
Yeah.
it feels like a felony to me. But I will say that we all must get educated.
Yeah.
It doesn't do anybody no good to stay in the dark and feel like, okay, if I don't pay attention to it, it's not happening, therefore it can't come in my house. I'm done with that. I'm done with it.
Yeah.
If it try to come up in here, I need to recognize and I need to have a plan to say, you don't get to be boss. I'm boss. Let's talk this thing out so it doesn't control the good we're trying to do. Miss Karen, we love you and we thank you. Like,
Yes.
it just gets better every time we talk to you. You gotta stop. You're doing unsung hero community impact
And
work.
I
What are we
just do
doing out
dribs
here?
and dabs. I don't go deep in the comments. If I do, and one of the things I want to be able to, I know you told me to remind you to say too that I'm happy if there's organizations out there that would like for me to come in and
Yes.
help do the trainings, or if you have clients that you want me to be able to talk to, you go through Raise Voices here, and they will be
Yes.
able to contact me, and I'll be happy to educate.
Yes, I'm glad.
Yes.
I'm glad you reminded. That's big. So you guys know the email azali777@gmail.com or leave a comment and definitely Miss Karen is ready. Let me tell you, she ain't got to get ready. You just got to reach out and we will make the connect just to make sure things are copacetic and that it is done in order. Yes, our laughter don't mean that we don't do order. We absolutely do order and we do it in right order. And we want people who truly need the help. No scamming, not over here. You need help, someone who needs help, please reach out. She's ready. She's able. She's got a whole support system there that can really educate and tell you what's out there to get you right. Okay. So listen, we appreciate y'all so much. We're going to be doing a few more lives with guests coming to really have the conversation with you guys. We want y'all to engage. We need to get that viewership up. And stay tuned because we definitely have carbon copy conversations coming where we're going to have more than one guest coming and vibing together. And we want you to see true network because unsung heroes, we just going to make some introduction and we're going to have organic conversations so that you see people can work together. Absolutely. Yeah. And we're going to be the catalyst of that to show you what that looks like.
So, quick plug that if people haven't been watching Raise Voices, please look at some of the other episodes because we all kind of tie into each other in so many different ways and how we can help our community. So really, I'm just saying, check out some of the other videos that they have made. It is phenomenal. I know I sit and I watch them too myself. And like I said, and I've even told, I'm like, I'm taking note. Oh, I can go to this person next year. And so we're here to help each other. So take that. They can also, again, get in contact whoever they may have had as guests there too. I'm giving a great plug out to them.
Oh, Miss Karen, nothing but love for you, baby. Nothing but love for you, baby. I see our partying is clean.
Right. We have the fun party. Party over here, party over there.
Nobody gets hurt from our party.
No, our parties are nice and fun. They literally are fun.
So Raise Voices, we love y'all. We want you to keep on your personal growth development. Remember that you just need to live simply and have intentional proactivity. You haven't heard me say that, but we've been saying that in the conversation. So I wanted to make sure that you remember we're still doing them. It sounds we're not out here just saying, oh, we're going to do everything and anything. Absolutely not. We are selective.
Yeah.
And I didn't say picky. Okay, people in the back row, I ain't mess with y'all for a while. I didn't say picky. Put the sign down. I said selective. We're careful. We have become careful because we really want to make better choices every chance we get. So just remember, simple living is not lazy living. You got to be intentional to simplify the thing to make sure you get the best out of it and you ain't got to hit repeat. Hey, I said it
That's
first.
right.
Listen, have a great day and we love y'all. Signing out. Bye now.
Bye.
See you again.